Going to be Miss Tram. She is a registered nurse and team leader. Congratulations at 8 West PCU. Miss Tram is going to talk about, I have to put my glasses now, improve prior to admission, PTA, medication, reconciliation. I would like to invite Miss Tram here.
Good morning, everyone, and happy Nurses Week to all of you. Thank you so much for all of your hard work in providing excellent patient care, and thanks for being here. My name is Tram, working as a nurse on AWEST. So I want to introduce you a little bit about AWEST. AWEST is a unit-based team with dedicated and caring staff. So as a result, patients on 27 beds on AWEST have been receiving high quality and safety of care. Today I'm proud to be here with you all to share about our project in improving prior to admission medication reconciliation on our unit AWEST. This project helps developing practices and can improve our MedRec performance in inpatient units. Throughout this presentation, you will hear me say MedRec, which is an abbreviation for medication reconciliation. So what about MedRec is so significant that we should address and try to improve it? Research studies have shown that MedRec reduced med error by 70% and adverse drug events by 15%. So these numbers show a significant impact of MedRec on patient safety. And what do you think how CRMH doing on MedRec? So let's take a look at 30 random patients' medication reviewed by pharmacists in 2015 as CRMH. 256 medication errors was identified out of 560 total medication. So as you can see, reducing med error through MedRec support carrier alignment with the triple arm of improved quality, lower cost, and better patient experience. Recognizing MedRec as significant, AWEST led it as a pilot unit in improving this process of prior to admission, abbreviation to PTA MedRec, through enhanced communication and clear roles between nursing and providers, reduce med errors, provide correct meds for patients, improve patient outcome, reduce costs by limiting waste during both hospitalization and at discharge, by improved accuracy of the PTA med list. So we use the DMAIC approach. At first, D is define the issue by define what MedRec is, and we distribute services. MedRec include 3 steps: verification, clarification, and reconciliation. And we also distribute services to the nurses' mailbox to identify practice and comfort level, as well as collect feedback of nurses. M is measure the process. We develop 3 collection tools. And A is analyze data, I is improve the process, and C is for control the process. In the analyzing phase from the surveys, we found that there was inconsistent prior to admission MedRec practices, such as some step in the process of PTA MedRec was skipped or unknown. And there was also unclear roles and responsibility between nurses and the providers. They're not sure who would be the one removing meds, and the nurses was uncomfortable removing meds. They asked for specific criteria when removing meds, and there was some difficulties in communication between nurses and provider. After gathering the med history, nurses was unsure how to get the provider response and adjust the mark accordingly. With and the next would be with 64 admission reporting forms, it showed that 46% only 46% met reviewed it by ED staff. The inpatient staff review met list more with 74.1%. And however, there was still 9% of the med list was not reviewed by neither staff, either the ED or inpatient staff. And most common med error we noticed was omission and incorrect math. And for the we also built a med review status tracker, which is on Microsoft Excel used data pulling from EPIC patient list. We use the tracker to observe the following measures. We track the percent of patients admitted for 24 hours with a status of PTA med list change need MD review. This indicating that a nurse already collect the med history, but he was still waiting for the provider to review and reconcile. And we also track the percent of the patient admitted for at least 24 hours with no med list status. So we don't have any status, so we don't know whether or not anyone have looked at the med list or not, because there's no status was entered. And this was a valuable tool. The status tracker was a valuable tool for us to helping to evaluate the compliance between the provider and nurses. I was pleased to see that the improvement that we can have more compliance between the pre and post project. The percent reduction was 35 to 40% down to 24% for both provider and nurses. In order to have those improvements, these are the following. The following was the implementation that we did. We partner with HR EPIC trainer to deliver refresher education to volunteer nurse super user on good metric practices, and nurse super user intern train other AWS nurses. Also, we partner with HR EPIC trainer to deliver refresher education to hospitalists and get their feedback on the process. So they say that if a patient was not taking a medication, we ask nurses to mark not taking and make sure to enter the reason why rather than removing the med. And ask the nurses to enter the PTA med list needs MD review status in so that it can flag the provider and to text by the physician reminding them to review the med list, and encourage provider to respond to nurse med list review requests in a timely manner. And these are our outcomes. MedRex has been a system-wide problem at Carolyn related to patient safety and hospital finance. So AWS PTA MedRex project is to reduce med errors and to provide correct med not only during hospitalization but also at discharge. Improve consistency in practice and accuracy of reviewing PTA med list through refresher education for both nurses and provider. Clarify roles and responsibility between nurses and provider. So nurse gather med history without removing med and provider reconcile meds. And improve communication between nurses and provider by paging to notify the provider after updating PTA med list or discussed during morning round. And with the lesson learned from this project, I would like to share with you a checklist in proper so that we can review PTA med list accurately. So if you see a red banner, please add all outside med in and review that with the patient, and then review each and every PTA medication with the patient, including name, dose, and frequency. If taking, mark not taking, and if taking, mark the last time patient took. If no longer taking, mark not taking, and enter the reason why. And make sure to update the med list status and click Must at Review. And these are our references. And I'm honored to work with Rebecca McKelvey, Andrew Ledwith, and Tamara Davison. I also want to give big thanks to A-West nursing staff and the hospitalists. Thank you for listening. Any questions?